Thank you for joining us, everyone. Today we are here for our panel discussion on dental careers post-equivalency. The whole idea with today's conversation is to talk to recent graduates, people who've just completed their equivalency process, people who have just graduated from university, talk to them about how they're going to approach their career now that they've achieved their license, now that they're actually going into the dental market. What are the tips that we have? What are the important skills that are needed? We're also going to talk about our CE courses, our continuing education courses, and we're going to talk about which course is important at which point in your career, give you some information about how we approach them. My name is Isha. I work with marketing here at Prep Doctors, and today we are joined by Dr. Marwan. Dr. Marwan is the head instructor here. He's the co-founder of Prep Doctors, and he's also the owner of multiple successful dental practices in Ontario. We're also joined by Dr. Trish. Dr. Trish Srivastav graduated, he completed his equivalency process in 2018, and he is currently working as an associate dentist with the Trillium Group in Ottawa. Thank you so much for joining us, doctors. Since today's panel is about careers post-equivalency, Dr. Marwan, what would you say are sort of the fallbacks of the equivalency process?
So the direct route you're talking about, right?
Yes.
So the direct route, people go through 3 exams. They go through the assessment of fundamental knowledge, then they go through the clinical judgment, and then the skills. The fundamental knowledge tests their knowledge, and then judgment, how to diagnose, and then the skills is their manual dexterity. But at no point throughout the process, there is a discussion of how to communicate with the patient-centered approach. There is nowhere in the process where they see how they can properly conduct an exam, how they can do proper record keeping, and how to prepare them for the business aspect of dentistry. This part is actually covered in university. So people who graduate from university, they are ahead of people who do the equivalency.
Mm-hmm.
In terms of technical skills and in terms of diagnosis, the foreign trained dentists, they're fully equipped like any other dentist.
Mm-hmm.
They just need to adapt to the system. So this is where I see the fallback. And this is what's making a lot of dentists be cautious when they're hiring, because they want to make sure this dentist, they don't question the skill of the dentist as much as can he integrate into the clinic, can he keep our patients, does he know how to communicate with our patients? Because at the end of the day, what makes a patient happy, patient is not capable of identifying how good of a technical skill the dentist has. Because you can do a decent job or a superb job and both they can last in the patient's mouth. But the patient will be able to identify if you have explained properly the treatment, he understands exactly what he's facing, there's a clear communication, and there's pain-free dentistry. This is what they look at. So this aspect of the equivalency is what we try to bridge in our courses. Okay, is how we help dentists to know how to conduct exams, how they should treatment plan, how they should conduct the treatment plan, how they should communicate the treatment plan with the patient. A lot of the areas where the dentists come from, we call it the doctor-centered approach.
Mm-hmm.
And they come with the mentality, for example, that as a patient coming to my clinic, I know what's best, I tell you what to do and you do it. But here it's totally different. Here we educate the patient. So when the patient comes to the clinic, we explain the different options the patient has. We explain the risks, benefits, and alternatives of each option. And this is called informed consent. And then once the patient understands each of them, we give him the opportunity to make the decision for himself. So that's one of the key things that I feel the equivalency process is lacking.
Okay, that's great. And Doctor, you talked about, especially difficulty to integrate into the Canadian practices, especially for international graduates. Someone who studied from a college in another country, came here, did his equivalency process. Is it more of a challenge? What are the skills that they need to have hands-on when they're going into the job market?
So you're talking about skills or communication, because there's 2 components for them to integrate. They're all capable of integrating,
Mm-hmm.
They just have to be given the right tools.
Okay.
So the first one, which I mentioned, we cover in the dental practice essentials, is they need to learn the codes, learn how they handle new patients, learn
Mm-hmm.
how to handle emergencies, in terms of communication, conducting a treatment plan,
Right.
and also we introduce a dental software so they understand the digital side of dentistry as well,
Okay.
in terms of documentation and charting and so forth. So this is one component that is the most essential, I would say.
Okay.
This is the most essential for foreign trained dentists. And this is what people who go through university here, they're trained in. Because in university, if I want to give you a quick picture of what happens, after we see a new patient in the oral diagnosis clinic, we book what's called a treatment planning session with a coordinator in the clinic, and they help us to treatment plan, to communicate with the patient and so forth. So that skill we acquire when we graduate.
Okay.
Now, and the foreign trained dentists, I'm not saying they can't communicate, but it's just the strategy, the way they handle themselves here. And also, there is accountability in North America, which sometimes doesn't exist in other countries. There's colleges here, there's regulations, so they have to follow those regulations. Now, in terms of skills, there is skills that are missing now in foreign trained and also in the graduates. Because when you graduate, you will find the university usually teaches you the basics.
Right.
They teach you one system, they teach you one approach. Sometimes they teach you textbook approach that has been adopted for certain period of time. Then when you graduate, you face the companies that are marketing so many different things. You face techniques that are being taught in CE. You face techniques taught in Endo and so forth. So they have to choose now what to do. And one of the key things in practice to make them successful is time. Because in university, they give you this 3-hour session to treat a patient. You don't have this luxury in clinic. In clinic, they give you 1 hour. You have to finish the treatment efficiently and with good time management.
Right.
So one of the key to the success, usually when I'll give you some experience when I graduated. So as an associate, the key is to look for things the clinic cannot do. So one of the areas where the owner of the clinic I worked at, he didn't like molar endos. That's what got me into endo. So molar endos are not that difficult. I'm not talking about retreatment. I'm talking about the first endo you do, a carious tooth and so forth. So molar endos are not that difficult. Financially, they're very rewarding. And there are techniques actually that you can master and you can do it in a time efficient manner, especially with the new systems that are introduced. So I went on, I took courses in endo, I advanced myself and so forth. And then I became the simple endodontist of that clinic. So they started to internally refer those cases to me, and it was rewarding. And slowly you build that skill. But I noticed that endo is what gets you the trust of the patient. Because in endo, the patient is coming with a lot of pain, and you're the one who's relieving that pain. Now, and people, they have very bad idea about endo. They always associate it with pain. So if you happen to be the dentist who can break this stigma, and you can actually make them go through a very pleasant experience where they come in with pain, they exit without pain, you buy their loyalty right away, and then they become your source of referral.
Absolutely.
So that's one of the disciplines that I think is important. The other one is, which we also teach, is basic surgery. Because basic surgery, I'm not talking about impacted wisdom teeth and so forth, just removing surgically a tooth. And it's not that challenging once you learn the right techniques, which is also not focused on in universities. So in that course, we teach simple, like how to raise a proper flap, how to suture back, how to section, how to remove bone, when to remove bone. So simple techniques like this in the clinic will give you the confidence and also will buy the loyalty of the patient.
That's great information. We especially love the fact that Dr. Marwan shared something about the beginning of his career with us. That's a great tip for people who are just starting out. Dr. Trish, you just completed your equivalency in 2018. You got a job at the Trillium Group right away. Share some of your experiences in the beginning of your career. What were your challenges that you faced? How was your process of integrating? Because just to share with our viewers, you did do your graduation from India before you moved back to Canada. Went through the equivalency process. There were a few gap years, of course, because of the equivalency process. How was it?
The first week is always like you cannot sleep. The reason being is, so first off, as a fresh graduate, you just have very little bit of experience. But then when you take into consideration the 2-3 years it takes when you're practicing and studying for all these equivalency exams, the gap increases more. So by the time you get your first clinical experience, there's almost 3 years of gap. So you're already going in with the cold feet, there's lack of experience, but you slowly build up. The one good thing is, the one thing that I really understood is that by throughout the ACS program, that at least I knew how to do general fillings and crowns. So that helped me out a lot. And so I guess that's the most bread and butter kind of procedure for dentistry. So at least on the first day when I had a few fillings, I slowly became more comfortable doing those, and then a crown. But one thing that Dr. Marwan said in regards to endodontics, that it is one of the most rewarding procedures that we do in the clinic. Unlike doing an implant or something else where you have to have them come back and have more chair time, root canals are definitely more rewarding. And that was one of the first thing I noticed too, that in my clinic, that the other dentists didn't really appreciate doing that much of root canals just because they find it more stressful. And same thing with the dental assistants, because of all the stuff they have to put up, all the things they have to put down, the cleaning and everything. So I started going more towards the endo route myself also. So like I said, one of the first CD course I did was on root canals.
Right.
The biggest challenge that I found, like within the first few months, was the record keeping and being it all digitalized.
Okay.
That's something that you have to really keep in mind, that your records have to be accurate. They should be telling everything that happened throughout your procedure. And at the same time, you're not just writing it, letting what you have done, but also in future, if something does come up, everything is written down, which is there to protect yourself also.
Right. So the record keeping is a part of our dental practice essentials course.
Yeah.
Dr. Marwan, can you tell us something about why you designed this course, how you prepared it? Because of course we do recognize that as a new dentist in the market, doctors need these skills. Doctors need this knowledge of.
Okay. So when they go, just to go back to the equivalency exams, in assessment of clinical skills, they do have a record keeping component.
Okay.
But that record keeping component does not resemble real life, because it's pretty much just projects they memorize. They know how to handle them, and it's the basics. You can say the basics of record keeping. But what's important for dentists to understand more than record keeping is what's an informed consent. And there's a lot of clinics, they practice informed consent in a wrong way. For example, they have these standard consent forms that people just sign without reading, and that doesn't count as an informed consent. So a proper informed consent is you need to actually explain to the patient, you need to customize it per patient. So that's important, and also it's important to protect you, because as any medical treatment, dental treatments, they do have risks, they do have failure rates, they do have longevity. When you give a crown, it has a certain lifespan. So it's important for the patient to actually understand this, because in our profession, patients have very high expectation, and they have also misconception. A lot of patients, they come, they think a filling is better than their natural tooth. So they feel that the filling you're putting in their tooth should last forever. But it needs high maintenance. No, the tooth is weaker right now. So they need to understand that. When we put a crown for them, they believe that this crown, they ask right away, what's the guarantee you give us?
Yeah, what's the guarantee?
On this. I don't guarantee, I tell them, the minute you walk out of this clinic, I don't guarantee it, because how do you use it? They might abuse the crown. They have to understand the limitation of this prosthesis we're putting in their mouth. So that's why documentation is important, but more than documentation is properly conducting the information to the patient, because if the patient has the realistic expectation, they will be more understanding and there will be less problems in the future. If I give a patient a treatment and I say this is the perfect treatment, it's going to last forever, and it fails after 2 years, he's going to be mad. Although technically I didn't do anything wrong. It just the way I explained it to him is in a totally wrong way.
So Dr. Marwan, these points that you mentioned, what are the other added things that we teach in the dental practice essentials course?
So in dental, we do some a lot of exercises actually, where we present X-rays, models. I get people to discuss with me as if I'm a patient, how they're gonna actually communicate these things to me, and then how to document it. Big part of documentation is not only the procedure, but it's the conversation with the patient. We need to document what we told the patient, and we need to also document what the patient told us. So that later on, if something arises, if they complain or so forth, the college will have a very clear notes telling them what happened throughout. If there's no notes, then it's up in the air. You can't defend yourself. Okay? And more important than just protecting ourselves is building the practice. Building the practice is gaining trust.
Right.
And gaining trust from a patient is through properly explaining to him. If the patient knows about the risk before, then he understands it's a risk. But if the patient knows about the risk afterwards, he will blame you. To give you a quick example, sometimes we put just a white filling. White fillings, they sometimes result in sensitivity. If you explain to the patient that this could happen, when it happens, he comes back seeking for a solution and he understands it's a risk. But if you tell him everything is fine, go home, and it happens and he comes back and you tell him, you know what, yeah, there is sensitivity associated with white filling, he's gonna think that you're actually just pulling off some excuse because you did something wrong.
Okay.
So that's why it's important, the communication and to document that.
Okay. So these are a few of the things that are a part of our Dental Practice Essentials course, and this is the course that we recommend to all the people who have recently completed the equivalency process when they're going into the job market.
That's my part of the dental, by the way, because the Dental Practice Essential is not only taught by myself. There is a lawyer that comes, there's an accountant, so it's different. I teach only that part which is related to the clinic, the software, how to conduct the new patient exams, how to document properly, how to get informed consent, and then we do treatment plans and we do charting on the dental software. That's my part. But then there's an accountant who talks about taxes, how to, whether they need to corporate or not. They get to ask him about that, and a lawyer who talks about the regulations, complaints, how to handle those things. So there's different aspects.
Okay, Dr. Chitrash, do you think that this knowledge, how important was knowing this whole wide range of things when you just started off into dentistry? How was it for you?
I think it's very overwhelming.
Okay.
Because one thing you realize by the time you finish ACS, you're like, oh, I did it. There is no real finish line in dentistry. It's basically reps, you're running around and around. So what I tell myself with each lap, you just have to get stronger and build your stamina. And the same way I feel about dentistry is that once you're done ACS, you do go for OSCE. And instead of spending the first few earnings on a nice card, go for some CDE courses. Because I think in the initial years, it's very important that whatever knowledge you're getting is all very helpful and a very useful tool. So even just knowing something as simple as how to communicate with patients, how to build a treatment plan, how to protect yourself from the legal obligations, and how to take care of the accounts and everything. These might seem like a very small things in the big picture, but they are all very essential.
And aren't these, Dr. Marwan, aren't these also extremely important to know when you're going in for that interview? What are the employers looking for when a person goes in for an interview?
So when they're interviewing, it's important. They want to see confidence, and they want to see that this person who's coming into the clinic, they know what they're doing. They know the system. A lot of dentists, they don't have the patience to educate, or they don't want to bring someone and they want to train them. Although it's possible to do, but because they're so busy, they just want someone who comes, give them peace of mind, he knows what they're doing, and so forth. So that's why they're asking, okay, do you have Canadian experience, and so forth. And what I tell people is for people who took the Dental Practice Essentials, I also ask them, go and observe for a certain period of time. Once they understand the system, going to the interview, you become in a position to demand rather than to listen. Because if I go to an interview and I'm in a position of desperation, I just want to get the job, they will sense that. They will know whether you know what you're talking about or not. But when you know the endo system you use, you know the type of material you use, you know how to do flaps, you know about the software. When you ask them what software do you use, this is a very important question. They're going to perceive it that, okay, this guy knows about softwares. Because knowing one software is going to open the door to all other softwares. They're very similar. They're not different from each other. The record keeping, knowing how patients are going to be transferred to them. So once they start asking these questions, and also when they ask them about collection rates, when they ask them about the associate percentage, if it's assignment, non-assignment clinic, the more knowledge you display in the interview, it shows that you have experience. And then it increases your chances to be hired. Well, if you go because in the beginning, I've had some colleagues who finished this route, in the interview they will say, we're willing to learn, we're open to anything. No, they don't want to hear stuff like that. They want to see that you already know what you're doing.
Okay, that's extremely valuable advice.
I definitely agree. Even with me, like as soon as I cleared my ACS, so it was around 6 months of time until I got my license. For 6 months, I shadowed in a clinic, and there were days when there weren't even any patients, but I would still go there. I would learn about how they're taking care of the records, what's happening in the back office. As like everything you need to learn, I think it's a good time, like right after ACS or right after OSCE, there is a big amount of processing time. I always suggest to my colleagues and friends who are taking the exams after me is spend that time in other clinics, see if you can shadow those clinics, because sometimes you might learn things from the people who are in the field for a long period of time that you might not learn from just doing the clinical skills exam or things you might have learned from back home.
Absolutely. That's great.
Definitely agree.
That's great. So, in the beginning, Dr. Marwan, you shared some information about Endo Courses. We actually just had a poll this week on our Facebook page where we asked our dentists what, according to them, were the most important skills to add to their practice. The winner for that poll was endodontics, as Dr. Marwan shared, and implants. We do have these CE courses, and there's this whole conversation about the idea of being a super dentist, broadening the scope of general dentistry, broadening the skills that a dentist goes into a practice with. Dr. Marwan, can you please share some information about these skills that are important and talk about the courses that we have?
Okay. So you mentioned the super dentist. I believe now we are in a period called the era of the super dentist.
Okay.
Because there's a lot of competition out there. And dentists, there's a lot of CE courses, there's a lot of mini residencies dentists can do. And dentists have expanded their skills to overlap with the specialists as well. But of course, I'm not undermining the specialists. Still, there are procedures, we need the specialists there. But the entry level of the specialists started to move to the dentist right now. One of them, for example, is molar endo. Because molar endo in the past used to be more of a specialist job, but now the dentist can do it. But still, retreatments, broken instruments, perforations, those are the specialist job. So by moving this component to the dentist, it made the treatment more affordable to the patient, because now patients feel, because before they used to come to the clinic, and I experienced that phase where I say, well, I'm going to send you to a specialist for this root canal. Oh, how much is it? $1,500? No, just pull the tooth out. But now when you provide them with an alternative, which is, okay, I can do it for $700, $800, then they're willing to save the tooth, which happens to be a better treatment option for them. So this is why these essential skills, and it's actually, if you look at the prevalence of the simple root canals that are available in the clinic, it's a lot. It's a huge percentage that is there. So you can save a lot of teeth with this skill.
Okay.
So that's why I constructed the root canal course, or the Endo course. And the way I wanted to construct it is, I didn't want to tell people I want to teach you how to do fancy things, because that's not what we are as general dentists. We want to do the basics, but we have to do the basics properly. So the Endo courses I've taken before, they focus. There's a lot of theory they teach you, which is important. I don't disagree, it's not important. But at the end, when it comes to the hands-on, they tell you to bring extracted teeth with you, or they bring you blocks, and you just work in a block. And when you do it in handheld, it's so easy. Because you see the end of the root, you see the axis, you just go in like this, and you feel that root canal is so easy. But this is what we do in day one. And then we move people to the lab. When we move them to the lab, we actually have teeth mounted in a simulating head, natural teeth mounted in the Darwin head. And those now they have to conduct anterior root canal on a front tooth, they have to conduct premolars, they have to do molars. We give them this opportunity, we tell them to do 5 teeth, and we have the x-ray machine, we're certified here, so they take x-rays to see. Now they are as close as possible, not 100%, because it's tough to simulate 100% the patient's mouth, but as close as possible to the patient's mouth. And this is the actual experience that they appreciate. The first day, usually they feel good. They feel this is a beautiful system, it's so easy, I'm just going in, I'm obturating, it's easy. Then when they go to the lab, they start to face the challenges. And they start to appreciate also the basic steps, because they think that this rotary is going to solve their misery, but no, the hand file is still important in the first phase. So they appreciate that, and then they get the experience to do at least 5 teeth. They take x-rays, they see the end result, and so forth. So we got very good feedback, as opposed to, and I've had people who've taken courses, other courses, for example, before they used to tell me, well, the other courses, they have the microscope. How many clinics have the microscope? there's no clinic. It's an endodontist who has the microscope.
Right.
As general dentist,
Mhm.
we don't use the microscope.
Right.
When we get to that level, very rare, very few dentists use the
Mhm.
microscope. So as a general dentist, we need to do anterior teeth, premolars, simple molars without the
Mhm.
microscope,
Of course.
quickly and efficiently.
Okay.
And this is what I want to give the people, is a technique to do those quickly and efficiently. So,
and they can take it right into the
Of course.
practice.
and they also, another advantage of working in the patient's mouth,
Mhm.
just to give you an example, an upper second molar, just like
Mhm.
right next to the ramus, very tough to access in the mouth. So when I have it extracted in my hand, it's so easy to do. Now the minute I put it for people in the mouth and they have to go in with an angle and to get that meat,
Oh, yes.
they notice the difficulty, and that's the techniques we want to tell them, is how to angulate, how to isolate, how to get that canal in the mouth, not
Mhm.
outside the mouth.
Absolutely.
So this is why this course actually is very popular, because people
Right.
enjoy it. We feel the vibe the second day.
Yeah.
For sure.
Yeah.
Dr. Trish was pretty new to his practice when he came in
Yeah.
for our Endo course last cycle. Dr. Trish, tell us why you picked Endo as a CE course to get into your practice at that point, and how was your experience? And are you using that skill right now? How's it going?
Well,
for
of
you?
course. So when I first started working in Ottawa,
Mhm.
there were a lot of cases that were coming in for root canal, and the thing is, back home we were still using only hand files. So over here we didn't have the hand file system, so I would refer to the other dentist, and in my head it was like, okay, there goes one patient, there goes two patients. So every week it was like 4 or 5 patients. That's like, okay, now it's going to a different dentist. So I needed to do a CE course for sure. And the reason I picked the prep doctor's course is there wasn't much of a gray matter. It was all black and white. So you do this, if this happens, if this happens, and you just follow those drills, and it was going smoothly from that point out. As well as the wave one system does make the whole endodontic treatment much easier for the dentist to do too. So I remember just after doing the course, 2 days later, I had a premolar case, and it went pretty smoothly from that point on.
Alright.
So, it's always fun coming back here, and because there's always more to learn. And the thing is, you can see the results of taking these courses fairly shortly after doing these courses, because you're actually not just able to apply it here
Mhm.
in the lab the second day, but also a few days afterwards in a patient.
Mhm.
But-
That's true, and as Dr. Marwan shared, the courses are designed in a way where it is easy to integrate them into the practice right away.
I just want to comment on one thing, because Dr. Trish raised the point, is he said it's easy to integrate, and this is one common question I get, is what should we take?
Mhm.
Because some people, they have this, they want to just take all kind of CE courses.
Mm.
What I tell people is, no, go to the clinic you're working at, see what's the demand for.
Mhm.
If the clinic has demand for sedation, go take a sedation course. If the clinic has demand for root canal, take well, endo is a basic.
Right.
But some clinics that you get a lot of impacted wisdom teeth, and you feel that this is the direction you want to move,
Mhm.
because so you have to practice whatever you learn as soon as possible in the patient's mouth, and you feel that it becomes part of you afterwards.
All
Of
right.
course.
So it is, as the both of you are saying, it is about forming a strategy,
Yeah.
strategizing
Yeah.
your career after equivalency.
Yeah, I always suggest that to even my colleagues, friends, anyone, that if you are taking CE course, good for you, but it's not like you go in and you take all the 6 courses in a short period of time. Take one, understand what you have learned,
Mhm.
practice it, try to make it a part of you, and then move on to the next thing. If you are taking, it's like studying 6 books at one time. You can read them all, but how many would you understand? Maybe half of it. So it's better to take one at a time, understand it, use it, and then move on to the next one. So,
All right.
And you said the most popular answer was root canal.
And implants.
And implants. So
Yes.
here I want to comment on the implant. People,
Okay.
they like implants just out of concept. They want to be able to
Yeah.
place implants.
that's
Mhm.
true.
But the hardest part of an implant,
Mhm.
which people don't understand until they put the implant, the hardest part is the soft tissue component, not the hard
Yeah.
tissue.
Mhm.
Because the hard tissue is very straightforward. You just use the drills, you put a screw in the bone. That's, if I'm simplifying it. But raising a proper flap, grafting, using membranes, which is something we teach in the basic surgery.
Okay.
This is what you need in order to move forward towards the implant. And we do teach implant there, but we
Okay.
do intro to implant.
Yeah.
We want people to have that idea about an implant, that opportunity to put just one implant so they get the feel of it. And later on, they will have to take other advanced courses for the implants. But the minute they get comfortable with raising a flap, they get comfortable with grafting a socket, they get comfortable with increasing the bone thickness, they will be more willing to move towards an implant. And can they practice the flaps right away? Of course, because they will use flaps for extraction of surgical teeth, and their confidence will go up. And then next, what they're gonna be doing is, after they remove a tooth, they need to graft the area. So they start with the simple steps as extract teeth properly, preserve as much bone as possible, graft the area, and be able to raise a flap, suture a flap back properly, make sure you have successful grafts. Once you get that phase, the implant will come in split second, because that's the basic.
Okay.
So later on, they can take the implants and so forth. And this is why actually, when we did the flap course, people were surprised with the amount of hands-on they had to do. We did all kind of flaps. They did the grafting. They even did a simple crown lengthening procedure. So they broke that fear of separating soft tissue from bone and seeing underneath.
All right.
Yeah.
So that's great information about another CE course of ours.
Yeah, that's the second CE course.
Yes. Dr. Marwan, is there any more information you want to give about that CE course before we move on to the next ones?
The surgery CE course, that's pretty much it. Is people ask us, because they are used. Another thing I want to mention is when they do extraction, they're using forceps most of the time.
Okay.
Which is not the most correct approach. They need to be able to use elevators as well, which is something that we teach, is how to section teeth, how to use elevators, how to do atraumatic extraction, because sometimes they think the forceps is the atraumatic, but forceps turned out to be more traumatic than just raising a flap and handling it properly.
Okay.
So and they'll be working on live tissue as well. So that also has excitement. I know for you not, because you're not a dentist, but usually people, they get excited when they can raise a flap.
Absolutely.
I took once one course which pretty much I knew most of the information being taught, but I learned just one new tip in that course, which it opened the door for so many things. It's called the releasing incision in a flap. So I learned how to actually break that tension, how to have a tension-free flap. Once I learned that skill, then in the patient's mouth now you can do whatever you want. So sometimes simple things open the door for big things in the future. So people usually they hear about fancy names like sinus lift. They want to do sinus lift, ridge split. Well, first get the basics, get the bone grafting, get the membrane, get the flap, and then later on those things will just fall through.
Okay.
And one more thing, sorry, the demand for those things is not high.
Okay.
How many out of the implants that are so straightforward or you can just handle with simple grafting versus those you need sinus lift? Much more.
Right.
I think that's one thing I always say is that we focus so much on the things which seem very flashy that we forget to do the basics, and that's one of the things that we need to focus more on the basic dentistry first before we jump for implants. You have to also understand when you're doing an implant, a patient is putting in a lot of money, which is probably his hard-earned money. So you have to respect what the patient is sacrificing too for a procedure. He's not just one patient, he's putting in a lot of effort too.
Absolutely.
So make sure that you are proficient at your work before you go for something else. And that's one thing I always say is that even with extraction, things can always go wrong. Learn the basics, how to fix things. One thing that took me a while to understand is how to use proper elevators. And a long time, of course, we have that kind of forceps dentistry that is taught to us, but it's much more better for the patient to have it as less traumatically as possible, just so you can place an implant later on, maybe just for anything that he wants to do for that space later on.
So Dr. Marwan, we're getting a question coming in about, since we're talking about CE courses and learning the basics and sort of understanding the gap between specialization and broadening the scope of general dentistry, there's a question that's come up about how specialists should approach practicing in Canada. Would you have something to add to that?
I can't. I have high respect for specialists. They're way more educated than me, so I'm not in a position to tell them how they should be practicing.
Okay.
They usually tell us how we should be practicing. So when I learned implants, for example, I learned it from Dr. Mark Lin, who is a specialist. So he taught us how to do implants.
Okay.
And I'm nowhere close to his skills, so I won't be in a position to tell him how to practice. But he told me how to practice. He taught me how to practice.
Okay.
And this is we have amazing specialists in Canada. They're also willing to share their knowledge and to help us advance because they understand the dynamics of the market.
Right.
So they're not in a position they're hiding information. They're actually teaching us, but they also tell us that when something is super complicated, they also teach us how to refer.
Right.
They teach us how to handle the cases that we have the skill for, and also when to refer to them and so forth. So we have a nice relationship with them.
Okay, that's
Okay.
great. Since now we talked about the basic surgery course, should we go on and talk about our Veneers course?
Yeah.
Dr. Marwan, tell us something about the Veneers CE course and.
Okay. So I would say out of the three, the veneers is not considered a basic.
Yeah.
Okay, it's not a basic course. It's
Okay.
more for people who are looking for the veneers, and it's more of it can be used as therapeutic and as cosmetics. And I personally use it more for therapeutic. So if a patient comes with fluorosis or they have these teeth that are hypocalcified and so forth, and the only option is veneers. Sometimes gaps cannot be restored or cannot be closed by orthodontics, so you will have to go to veneers. So those skills are essential because also veneers is one of the aspects that is touched on briefly in universities. They don't teach you heavily how to do veneers. So what we did in this course is we teach people how to do simple veneers, and we also teach them full mouth.
Okay.
How to do full mouth. So we do touch on the cosmetic part as well, but what we also focus on is how to properly select the cases because you want to have success.
Right.
And veneers have high risk, so you need to select the case properly in order to get the best cosmetic result, but also preserve health.
Right.
Because I see a lot of cases of veneers where the smile begins as nice, but later on they end up with gingivitis, the gums is bleeding, and so forth if it's not done properly. And veneer now with the advancement in technology and the introduction of digital dentistry, so I split the course into 2 days. The first day I teach them the traditional way of prepping veneers, different type of veneers. When do we involve the contact? When we not need to involve the contact? When do we involve the incisal edges and so forth? And how to take a proper impression and how to temporize. Temporizing a veneer is actually the tough part that people struggle with. So we teach them the temporization, and the second day we teach them scanning veneers because a lot of dentists now are starting to get their scanners.
Right.
Some of them they even have CEREC machines, so they can make the veneers on the spot. So we get them to scan, and we also get them to design veneers on digitally, and they get to also process one of them.
Okay.
So we work with Patterson Dental, actually, so we use their facility. So they get to process a veneer, and this is one component that is unique in this course is not only they know how to prep and how to take impression, but they also see the end result. And we teach them how to glaze, how to polish, and so forth, and then they get to cement it. So they learn it from pretty much A to Z.
Okay.
They learn veneers from A to Z, and the exercises we do is not one single veneer. We teach them from canine to canine, and also we do premolar to premolar. So they get to use the labs, they prep them, and we had also good feedback. But as I said, veneers, for people who take veneers usually are people who are more into the cosmetics usually, or people who have this demand in their clinic.
Okay.
And to be honest with you, the veneer, once you become comfortable with, usually this is how dentistry works. What you're comfortable with, you start to offer that treatment as an alternative. So, for example, if you're not comfortable with veneer as a dentist, sometimes you find yourself leaning towards a crown. But once you become comfortable and you have faith in veneers, then sometimes a veneer is a much more conservative option than a crown. And and it's more affordable for the patient and will get you the result that you need for the patient.
Okay, that's great advice. Dr. Trish, if you can tell us something about what your approach is in terms of selecting selecting a CE course, because you started with Endo.
Yes.
How are you planning to go ahead now?
So the thing I look for is what is needed as of now for me in my clinical setup. So one of the first things was definitely the root canal CE course. After that, the new trend was with the Invisalign. So that was one of the second courses I took. It wasn't because it was very much needed for me, but there was a big demand of it in where my clinic is located. That we constantly had patients coming in asking about Invisalign. So with Invisalign, it was more of a trend basically. So right now, Invisalign is more in a trend, so there's more people asking about it. So I did a course on that. Of course, now the nitrous and sedation is something that you should definitely also do the CE course on, because not all the patients are in the same amount of mentality when it comes to getting the treatment done. Some are more anxious, some are not. So you have to be ready for each kind of temperament from the patient.
Okay.
Now the next course I definitely would be taking would be the flap course, and that's one of the reasons that I look for courses is what is needed. Where am I lacking? What skills I need to upgrade more? What skills I need to learn more about? Where am I having problems in a clinic? And then I want to figure out how to solve those problems. So of course, like I said, with any clinic, you have your good days, you have your bad days. You have your good days, and basically you have days where you learn something new. So I had a few learning days when it came to extraction, so I decided that I need to learn a little bit more, so just trying to put it in the nicest way possible.
That is true. Dr. Marwan, if you had to give a piece of advice to someone who's trying to strategize the CE courses that they take at different levels in their career, what would be your advice for them?
Well, the advice is, the first thing, as I said, basics. So usually when they ask me, I say, should we take all the CE courses? I tell them usually the veneers is not something you're going to be jumping on right away. But endo definitely is a basic. There's a high demand for it. And the flaps. These two I feel are actually the basics of the basics that they need to know now out there. So that's why I tell them my recommendation is this. And veneers comes down the road usually. A lot of people we see they come back for the veneers later on when they have the demand and they've mastered the basics.
Right.
And what I hear from people who take the flaps with us is when they go later on to take more advanced implant courses, they feel more comfortable because they've already covered a big component that in the implant course they teach you so quickly. Because when you're coming to take an implant course, they're not going to start to teach you the ABC. They want to get to the implant and they're going to skip all those ABCs.
Right.
So I think these two courses are crucial. And the sedation, there's a course by Dr. Haas, Daniel Haas, by University of Toronto. I also recommend people to go take that course. But I also tell them that don't rush into it. Make sure that there is demand in your clinic, because some clinics they don't in the GTA. But you're from Ottawa usually, when I used to work in Guelph and so forth, they have high demand for sedation. So you need to see the demand and move on. But it's one of the popular courses as well.
Okay. That was actually one of the questions that came in from Dr. Fadi Tatari about the nitrous oxide sedation course. So we hope we were able to answer your question, Doctor.
And I'm going to give an additional piece of information on the sedation since that was asked. Plan out, because some people they actually want to go further into the sedation. There's IV sedation courses. But you need to take it within 2 years from the time you take the conscious sedation with Dr. Haas. So if you see that demand, then maybe that's one direction you're going to go in. So plan it out, but make sure you have the patience, because I think it's around 18,000 the IV sedation. So it's a huge investment. So you want to make sure that if you invest into it, then there is a return that's going to be rewarding afterwards. If you don't have the patience, then there's no point.
Okay. That's great advice, Dr. Marwan. This question came in from Dr. Mariana. She's asking, as a dental office in Canada is built as a team environment, how would you advise dentists with no Canadian experience to become a successful team player? Sure.
All right. So one thing I realized as soon as I went into the office, the other dentist left after working there only for 4 days. One of the big problems, so one of the things that he said that the staff isn't nice, and he left. So going in already, I was kind of concerned, like, okay, would they like me or not? But what you have to understand, they all want to work, and they all have their own personal lives. So when I'm in the office, I communicate with them in regards to whatever is only happening in the office, and that's it. At the same time, you have to understand there is a hierarchy. They understand that you will be the main provider in the clinic. You'll be the main reason of productions. But at the same time, you have to respect them for whatever work they're putting in. And just once in a while, just saying a good job and you're doing a good job, listening to them when they're a little bit more concerned, and take them as somebody who is also trying to work in the same clinic and with the same goals that they want the clinic to be successful really helps. If you go in demanding, thinking that you'll be respected from day one as a dentist, that doesn't really happen anymore. You have to earn that respect. You have to show that you are a good dentist. You have to show them that you're a good person to really get the respect of the staff. So that would be the way I
That's that's very helpful advice, Dr. Trish.
Actually, that's very important. It's the same thing as people, everyone in life wants to feel appreciated.
Yeah.
If they don't feel appreciated or respected, they're gonna leave.
Of course.
And that's the staff in the clinic. So as a dentist, a lot of us come with big ego, so you have to watch out, because when you're in there, you're not God in the clinic. You are the main provider, but they're also there to help you out. And one aspect that dentists miss out on, especially when they're associates, is the receptionist is the most powerful person.
Yes.
Actually, it's not you,
Most
because she's the
definitely.
one who's picking up the phone, and she's the one who's doing the schedules. So if you get on the bad side of a receptionist, you
A lot of empty days.
a lot of empty days. Yeah.
Okay, that's
Yeah.
that's something very
Yes.
important. So
Make sure you get them good Christmas gifts.
All right. Can you explain the difference in regards to working in a dental office that is a part of a big corporation as opposed to working for a family practice? I think Dr. Chitrish would be great to start with that, and
All
then
right.
Dr. Marwan will be
So-
able to add to that.
I think one of the main thing that you would find a difference. I worked for a few weeks in a clinic that was owned by a dentist. There's a big variation in work. The reason being, so a corporate running dentist clinic is more running towards the production. They don't care about how many patients you're seeing. They don't care how many hours you're working. They care more about the production of the work. Whereas a normal clinic that is run by just one dentist, he wants a dentist there to ease up most of his load too. And he has that kind of demand that they need a different dentist in that clinic to sit. Alright, so it's not more production, but also in regards to they need another dentist in the system. In a corporate, it's not like that. They have already pre-planned everything. They have their hours fixed. They have their clinics fixed. They want you to go in, start seeing the patient, and it is more recall-based also. What does it mean with the recall-based dentistry is most of the patients will be seeing the hygienist first. They get their x-rays taken, they get their intraoral pictures taken. You go in, you go through all of the x-rays, you go through the intraoral pictures, you make the treatment plan, and then they see you for the rest of the treatment. And there's a recall period that every 6 months they want you to keep coming back for the hygiene. After every year they want to do a full reset of all the x-rays, or maybe 2 years, depending on the insurance. And it goes accordingly. So there is a fixed amount of time you have to spend with each patient. Even if they don't need a treatment, you have to go in for your recall checkups and everything, provide those. And then if you have any diagnosis, you form a treatment plan accordingly and go on.
Right. Dr. Marwan, please add to that.
I'll summarize it in an example. So family, when it's a family-oriented dental practice, most of the attention is given to the well-being of the patient and the loyalty of the patient. Corporate is given towards production. So one example is once when I was looking to buy a practice, there was one person, it's family owned, one practice, the dentist owned one practice, so it's family dental office. And when he wanted to sell it, his main concern was he not much the price, versus he wanted a dentist who can take good care of his patients after.
Exactly.
That was his main goal. But if you go to a corporate, their main goal is to get the maximum profit. And we as dentists, by the way, our profession is a mix of health care and business.
Yeah.
And there's a fine line. And this is what I advise a lot of dentists. When you're in the room, you have to forget about the numbers. And some offices, unfortunately, they push you to get the numbers. So if that's always in your head, then you're gonna start to become more aggressive in treatment, and that's not where you want to be heading. You always in the room want to take yourself away from the numbers, so you can give the best option for the patient, and then the financials will follow through.
Right.
So when we worked as associates, we always were in a position where we are between. We give the right advice, and then you have to take sometimes the heat from the owners about the advice that you have given. But you stand up for it. Eventually, it will balance out. But at no cost, the dentist should compromise what they should be doing for the patient. And the patients will sense that. And the patients will follow you once they sense that. They will follow you. I have patients coming from Montreal, so they'll follow you for hundreds of kilometers when they feel that you're giving them the honest advice.
Absolutely. So it definitely is about building that loyalty with the patient for your practice. And it's great that you gave our listeners
Yeah.
both the sides of the picture and how.
One more thing on corporates, by the way, they also differ from one branch to another. Like
course.
sometimes I hear the same corporate, one clinic they have is amazing, they care for the patient, and
Right.
so you can't actually generalize that this corporate is.
Of course.
Yeah, it varies from one to another.
Right.
It's not like pharmacy.
Mhm.
For example, because pharmacy, the interaction between the pharmacist and the patient
Mhm.
is not so intimate. They're just advising them, consulting them on medication.
Mhm.
So the patient is okay to change pharmacists, or actually there's no loyalty to a pharmacist. They
Right.
just go
Yeah.
get the medication. But as a dentist, you're actually getting very close to the patient.
Yeah.
You're working in their mouth. So
Absolutely.
there should be a trust relationship.
For sure.
You have to be a little transparent with your work. Like one thing I've noticed over the last few months that I've been working, I had patients coming from different clinics.
Mhm.
They would come and they say, "Oh, I'm really worried. I just moved from Montreal to Ottawa. I have 16 cavities that needs to be filled." And then you take the X-rays, you take the pictures. Even when you're really trying, you are maybe able to find 3. So open transparency works the best. I know one thing that I always say is that instead of me getting a lot of new patients,
Mhm.
it's more profitable to have patients that keep returning back to you.
Absolutely.
So, and that will only happen if that patient trusts you and he trusts your judgment when it comes to treatment
Mhm.
and how comfortable you are treating those patients.
Absolutely.
It's okay to say you don't know a procedure. It's okay to refer once in a while to a specialist.
Mhm.
You don't need to make sure that everything has to be done only by you. All right.
Absolutely.
It's okay to say that, hey, I don't do this. I'm not good at this,
Mhm.
or maybe I'm still not experienced enough for this procedure. I'm going to refer you to a specialist.
Right. That's actually very important, that the light that you threw on these topics, because it is going to help our listeners choose the dental practice that they decide to start
Of
their
course.
career with, what direction they want to go in. Dr. Marwan, there's one more question about, are CE courses necessary?
Of course.
As simple as
Now,
that.
do they have to do them? Of
Mhm.
course, because it's a requirement by the college.
Right.
Yeah.
So
right.
they will have to take CE courses at
Every
some
3
point.
years?
Every 3 years. So the
Mhm.
cycle starts by the time you get your license. It's a 3-year cycle. It's divided into 3 cores: Core 1, 2, and 3. Core 1 has to be specific courses, usually provided by the college. You can do it online.
Mhm.
Every point counts as an hour. So
Okay.
15 points, 15 hours. Core 2 is courses that are approved
Mhm.
by, for example, the AGD or
Right.
ODA and so
we
forth.
are AGD approved?
We are AGD approved,
Mhm.
so we are Core 2. So
Right.
that's 45. And the last 30 are actually Core 3.
Mhm.
So there are any courses, they don't have to be approved, but if you take more of the approved, they count towards Core 3 as well.
Right.
So you have to accumulate 90, and once your cycle ends,
Mhm.
you start from 0 again.
Okay.
So if you took, let's say, 200 points in one cycle, it doesn't carry over.
It doesn't. Okay.
Yeah, by the time you start the next cycle, you have to take other 90
Right.
points. Yeah.
So you have to take CE courses, and if you're gonna choose CE courses, then you want to choose something that you can take into your practice.
Exactly. Yeah.
You can make a profitable practice around it, add on to your skills. So it is very important. Okay. While we're talking about the CE courses and their importance, I just want to say that the offer that we have running today is that we're offering $100 off each CE course for the next 48 hours. So until Tuesday, end of the day Tuesday, all of our CE courses are at a discount if you register before end of the day Tuesday. That's all the questions. If there's anything you want to end, if there's a piece of important advice that you want to offer to our dentists who are just starting out, what would you say, Dr. Marwan?
I would say my advice always the same, not only to dentists, to even people going through exams. Always talk to people who have positive experience.
Yes.
Don't talk to people who have negative experience,
Mhm.
because that will change your attitude. So when you talk to people who passed from first time or succeeded, when you talk to people who found a job and they're working, then you're gonna have that confidence and move forward. But if you, and unfortunately there's a lot of negative vibe in this community, so always I hear there's no jobs, there's no this, so they always spread the negative. No, that's not true, because eventually everybody gets somewhere. And talk to people with positive experiences, you'll feel better and they'll guide you in the right path.
Right.
That's my.
That's
That's why I was emotional. Well, I'll put it in the perspective of what I went through over the last
Absolutely.
after finding a job is, don't take it as everything has, like the race is over. Like I keep saying that again and again, it's because you can never really think that now you're done. You have to keep studying. You have to understand that you're not the first that you go into a clinic, the owner or the patients will come with a bag of money and just give it to you. You have to work. Sometimes you have to maybe go through a few months without seeing a proper paycheck, but it will come if you be consistent with your work, be honest with your patient, be humble to your patients and to your staff. And just because you are somewhere, if you find an opportunity, help the people around you too. Success is not defined by just one person getting to his goal, but as a one person who not only finds his goal but helps other people around them reach their goals.
That's great advice, Dr. Trish. That's it for us today. Our CE courses are all coming up in February, so please take a look at that. Look at our CE courses on the website. If you're just starting out, the Dental Practice Essentials course is what you want to look at. We'll be talking about everything from building the resume to preparing for the interview to knowing the basic skills that you want to go into your interviews with. So take a look at that. Take a look at all of our CE courses. They are running at a discount today, and running at a discount till Tuesday. So take a look at that, and thank you so much for joining us, Dr. Marwan and Dr.
Thank you, Dr.
Trish. Thank you guys for watching.